Tell me, how old was Julian when you first became aware that he had Tay-Sachs disease?
He was 1 year old.
1 year old. And when did you, at what age did you notice that his development was not proceeding normal? In other words, did Julian ever turn over from side to side?
He was 9 months. 9 months.
That he turned over?
He
Yes,
crawled
right,
a little
right,
bit.
right.
And
What about sitting with support?
sitting, no, alone, not
No.
alone.
Right.
Only with the help.
With help, right. And when did you notice that his arms, his feet, his hands were stiff, spastic?
Spastic is 3 months.
3 months?
Yes.
That was early. And when did he have a lot of difficulties in terms of swallowing, drinking by bottle or swallowing any solid?
He has infection, and then he become this.
Right.
And was heißt, Tag ist gut, and then
1 day is good.
One day is good, and another day is not so good.
Right.
And it's not good, and then become this here from
the
pack,
G tube, the gastrostomy.
and
Right.
medicine is for this. I give the medicine from pack,
Right. Yes.
and this is better.
When at what age did they do the hexagene test on him?
15 months.
15 months.
So that was really the when you got the final diagnosis, the actual diagnosis.
The diagnostic.
Right.
It was in November, last November.
Right. Yes.
November 2010.
Now this is his another treatment for him of stem cells, and even though he had the neuron stem cells and the brain growth factors and the hexagene, he showed very little improvement with that first treatment. Correct?
Yes.
Okay. So you understand that that the big difference with his treatment this time is that we're trying to have the hexagene that he lacks or has a very low level to try to get that hexagene spread throughout his brain cells more widely. And that's why we use this virus vector. So the same treatment again today as he had 2 days ago. He's going to have the hexagene inserted into the viral vector, which is an adenovirus strain 2, and when that's inserted into the central nervous system and brain, we expect a more widespread. So in a sense, using the same word, we're going to do a transfection of the brain cells of the hexa. So it's really not an actual infection. It's just a term to indicate that it's more widespread absorption into the brain itself. And in addition to that, he will get neuron brain stem cells that have the normal hexagene, and he'll also get various brain nerve growth factors. And the best way for us to watch hopefully his progress is by your communicating to me 3 months and 6 months from now.